So today is our workshop. Is talking about diabetes awareness and prevention. So the information on this webinar is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. Please do consult with your physicians for any questions, or you can call Tzu Chi Health Centers at 626-281-3383 for any questions. We are so honored to have Miss Jennie Quon, who is a clinical dietitian and a diabetes educator at Palo Alto Medical Foundation. Currently, Jennie is also a consultant for the Chinese Health Initiative and at El Camino Hospital, and pioneering the first Chinese language diabetes prevention program in the Bay Area. So let's welcome Jennie, please.
Okay, thank you, Monique, for your kind introduction. Yeah, I did the workshop last week in Mandarin, and it's grateful to be given another opportunity to do the same workshop to talk about a subject that is very dear to me, and that is diabetes prevention. I am a diabetes educator, so you can imagine I deal with diabetes at work all the time, but this is also a topic that's very personal to me. Both my parents had diabetes, and my mom is 83 years old, and I manage her diabetes care. And I'm also at risk for prediabetes myself. So I think I can speak from both of a clinician and a patient and a caretaker perspective on this subject. I don't have anything to disclose, but here's my disclaimer. You can look at that. But I want us to look at our outline for today's webinar. So we will talk about understanding diabetes, the epidemiologists of diabetes. Oops, let me go back here. I don't mean to go to this next page yet. Also the pathophysiology of diabetes, risk assessment, diagnosis of diabetes. I want to highlight the risk assessment here, which is here. I think this is a key in preventing and delaying the onset of diabetes. I have included a risk assessment for prediabetes in this presentation, so we can do it together and find out your risk of diabetes. So go ahead and grab a pen or paper, and we will be doing that in a little while. And then I would talk about the lifestyle that lower the risk of diabetes, including physical activities, nutrition and diet, adequate quality sleep, and stress management. Then finally, I will finish by discussing some tips in managing diabetes. Diabetes prevention is a very timely subject at this time. For the past years, because of COVID, we all, many of us work from home because of shelter in place. We cut down on our activities, the gyms are closed, people were even afraid to go out to walk. And as a result, we have become less physically active. And at home, a lot of people, because there's not much of a structure when they work from home. And I see a lot of people skip meals or eat their meal at odd hours or snack mindlessly in front of the computer. So at my workplace, I have seen at least a 50% increase for newly diagnosed diabetes cases in this past year and a half. But the problem of diabetes does not start with COVID, but COVID just make it worse. So let's look at this 2020 report from the CDC, Center of Disease Control. You can see that 34% 0.2 million people have diabetes right now, and that is 1 in 10 Americans. Moreover, we also have 88 million Americans who have prediabetes. Now, prediabetes means those who have their blood sugar is higher than normal, but not at the level of diabetes yet. And this means 1 in 3 people in America have prediabetes. Yet, that's not the scariest part. Of all these who have prediabetes, only 20% are diagnosed. That means 80% of those who have prediabetes don't even know that they have it. Let's look at somewhere closer. A recent study analysis from UCLA found that 46% of California adults are pre-diabetic, or and you can see the total, about 55% are neither diabetic and pre-diabetic. So we look at the 46 plus the 9%, that is 50% for both diabetic and pre-diabetic. And among those who are over the age of 55, the rate is more than 75. This is the group. Blue is the diabetes, and the red is the pre-diabetes. And you can see that in this age group, when you add up the both the diabetic and the pre-diabetic rate is more than 75%. That means 3 out of 4 of this age group are either diabetic or pre-diabetic. I want to talk a little bit about Asian American diabetes statistic, because it's just that it hardly in the mainstream medical news. But I want us to be aware of that. 21% of the Asian American are diabetic. And in the Asian population, diabetes is most pervasive among South Indians, Filipinos, and the Chinese. Asians are 60% more likely to develop type 2 diabetes than Caucasian in the same height and weight. We call it body mass index, BMI. About half of the Asian Americans with diabetes are undiagnosed, highest of all the ethnic and racial groups. So the question is, why are there so many skinny Asians have diabetes, and how come half of them are not diagnosed? Well, diabetes have always been associated with obesity. Asians are usually smaller built, and we look skinny or at least not overweight. So if you look at the appearance of Asians, a lot of time you won't guess they are diabetic or at risk of it. So many of them never get tested, and so they never get diagnosed. So how come the skinny Asian get diabetes? Well, I believe diet may have something to do with it. Asian diet is usually high in carbs. These high carb food are often very refined, like white rice, mantou, noodles, and they're high in glycemic index, meaning that these foods raise blood sugar really fast and cause the blood sugar to spike. But diet alone cannot explain everything. Studies have found that Asians are likely to have more abdominal fat than other ethnic groups of the same waistline and BMI. And this is probably associated with some genetic abnormality. But let me give you an example. Say we have 2 ladies, both are 5'4", weigh 130 pounds. They are right within the normal BMI. They look pretty fit. Now, even though their body shape may look alike, but they are very different in their body composition with the muscle mass and fat ratio. The Asian lady is likely to have less muscle mass, but more body fat. Wait a minute, you might say, but she looks so trim, so fit. Where's the fat? Well, according to the studies, the Asian like to store up the fat inside the body cavity. This kind of fat is called visceral fat. Now, the visceral fat provide cushioning for our vital organs, like the heart, the liver, and we need a little bit of it. But when the visceral fat becomes so abundant and fill the space in our body cavities, it will trigger inflammations and cause many metabolic issues, such as diabetes, insulin resistance, and fatty liver. So let's look at what is diabetes. Well, the definition of diabetes is abnormal blood sugar level. There are several types of diabetes, but we are going to mention the three major ones. And actually the focus of today's webinar will be on type 2 diabetes. You always heard about type 1 and type 2 diabetes, right? So what's the difference? Well, in type 1 diabetes, the problem is lack of insulin. The body is no longer able to make any insulin. So for type 1 diabetes patients, once they're diagnosed with the disease, they need to take insulin for the rest of their life. Type 1 diabetes is believed to be an autoimmune disease where your own autoimmune system attack and kill off the insulin-making cell called the beta cell in the pancreas. And it's usually type 1 diabetes, they come on very sudden, and it's usually among the younger populations. And it is account for about 5% of all the diabetes. In type 2 diabetes, the problem is not about making enough insulin, but we can see in the peripheral tissue, these tissues are like in such as muscle and liver, okay? And these cells have become resistant or insensitive to the effect of insulin. So as a result, your body compensates by making extra insulin. So type 2 diabetes composed of about 90 to 95% of all diabetes. It is a chronic condition and is pervasive among people who are 40 years old or older. But we have seen a younger trend. More and more people are becoming diabetic at a younger age. Gestational diabetes, the last type of diabetes we're going to talk about, is a form of a high blood sugar affecting pregnant women. The percent of hormones of this pregnant lady have become so strong that it interferes her body use of insulin. And, but fortunately, this is a contemporary situation. Once the woman delivered the baby, her blood sugar usually go back to normal, but women have gestational diabetes do have a higher risk of getting diabetes in the future. Now, we have mentioned insulin resistance quite a few times. This is a relatively new term. Many in the medical and wellness community now believe that insulin resistance is the root cause of many chronic kidney disease. So I like to talk a little bit about that. Now, insulin is a hormone that helps to metabolize the glucose in our blood. After you have a meal, your blood sugar goes up and it triggers the pancreas to make insulin. The job of the insulin is to bring glucose from the blood into the cells so that the cell can use it as energy, so that the cell can use it for energy, and at the same time, the glucose in the blood will come down to normal level. So when you have insulin resistance, your body will need more insulin to do the same job. So here's the definition of insulin resistant. It's greater than normal amount of insulin are needed to achieve normal blood sugar levels. So think about your pancreas has to make a lot of extra insulin day in and day out to maintain the normal blood sugar level. So after 30, 40 years later, it can become quite exhausted and may no longer able to make enough insulin to maintain the blood sugar anymore. And eventually the individual will become diabetic. As a matter of fact, at the time of diagnosis of diabetes, the pancreas is only making half of the insulin. Now, insulin resistance is not only affecting blood sugar, it is related to a host of chronic conditions called metabolic syndrome. Now, these 5 conditions described here are used to define metabolic syndrome. Central obesity, sometimes called abdominal obesity, high blood pressure, high triglyceride, high HDL cholesterol, low HDL cholesterol. HDL cholesterol is your good cholesterol. So and we like it to be high if it's good, but if you have a low level of good cholesterol, that means there's something happening in your metabolic process. So that could be a risk. And also we have insulin resistance, which is with the evidence of high fasting blood sugar. Having any of these 3 conditions will qualify you for metabolic syndrome. So that's why we see people with high blood sugar also have high cholesterol and high blood pressure, or being obese. So these are, because they are kind of interrelated. So although we're not sure about the root cause of insulin resistance, there are some risk factors that are associated with insulin resistance, for that matter, diabetes and prediabetes. Now, first of all, we see is the age, 40 years or older. Your ethnicity, if you're Asian, Hispanic, American Indian, African American, basically non-white, you are more at risk. Family history, genetic, your parents, siblings, or even blood-related relatives that have diabetes, you might have carry the same genes as well. Women who had gestational diabetes or have given birth to baby who weighed more than 9 pounds or more at birth. Well, these risk factors are called non-modifiable factors. There's a whole lot you can do about it. Studies on chronic disease have shown a 20-80 ratio. Genetic component only account for 20% of the rest, while the rest is up to us. So here are some other risk factors that are within our control. Let's look at what they are. Overweight, especially central obesity, unhealthy diet, high fat, high carb, processed food, sedentary lifestyle, lack of exercise, sleep disorder like insomnia, sleep apnea, and also stress. We can all do something about it to a certain degree for this risk factor, isn't it? So here's the risk assessment that I talked about at the beginning of the webinar, that you can do it to find out if you're at risk of prediabetes. It is developed by CDC, the Center of Disease Control, and American Diabetes Association. And you can go to their website to download this questionnaire, or you can do it online. And if you like, we can do it together now. There are 7 questions altogether. I have put them in the next few slides. Just want to let you know that in this workshop, because we're focusing on Asian Americans who we are at risk of type 2 diabetes at a lower weight. So I have adjusted the weight table in, this is question number 7. So I have adjusted the weight table. Now, just remember in this test, the higher the score, the higher the risk. So if you can get your pen and paper ready, or you can just do it in your mind, you know, we can do that. And so let's get started, shall we? So the first question is, how old are you? If you're younger than 40 years, you get 0 points. 40 to 49 years, you get 1 point. 50 to 59 years, you get 2 points. 60 years old or older, 3 points. Question number 2, are you a man or woman? Man, 1 point. Woman, no points. Number 3, if you are a woman, have you ever been diagnosed with gestational diabetes? Yes, 1 point. No, no points. Number 4, did you have a mother, father, sister, or brother with diabetes? If yes, then 1 point. No, 0 point. Number 5, have you ever been diagnosed with high blood pressure? Remember, we talked about the metabolic syndrome. They like to go hand in hand together. High blood pressure with high cholesterol and high blood sugar. We call in Chinese, we call the 3 highs. So if you've been diagnosed with high blood pressure, okay, please give yourself 1 point. If none, then no points. Number 6, are you physically active? Let me explain that a little bit. What is considered as physically active? We're talking about workout 20 to 30 minutes, maybe walking or biking, 5 to 7 days a week, each time about 20 to 30 minutes. If you do that, you have no points. And you can give yourself 1 point if you don't meet the criteria. Now, the last question is on weight and risk. This is the original weight table. You can see the more you weight, the higher your risk is. So in this, here is the first column is you get 1 point if you belong to this weight range, and in the second column, get 2 points, and the third column get 3 points. Now, as I said, I have adjusted this table for the Asian. Okay, you can see basically mine is the first line is kind of the first column, the lowest weights here is a little bit crooked. Sorry about that. But so this is how I get the table here. So let's do an example. All right, I use myself as an example. So I'm 5'3" and I weigh 122 pounds. So I will go to find my height. Then I go across to find out where I belong in my weight. So I'm 122. I'm not in any of the group here, so I don't get any points. Now, if I weigh 130 pounds, then I would, if I weigh 170 pounds, I would give myself 2 points because I'm in the 2 point category. If I weigh 230 pounds, I'm in the 3 point category, and I would give myself 3 points. Okay, I think that's pretty straightforward. So find your height, and then see which category of weight you belong to, and then add up the points. All right, so I believe everybody get that. Now here's a website of the ADA, American Diabetes Association, where you can take the test again if you like. But let's add up all the numbers. Okay, all right. So if your total score is below 5 points, you are at a lower risk of having diabetes. Congratulations. But if you score 5 points or higher, you are at increased risk of having prediabetes, which means you are at high risk for type 2 diabetes. I highly recommend you to get your blood sugar test in the lab. Only your doctor can tell for sure if you have type 2 diabetes, prediabetes, or neither. Now, you probably heard about some symptoms related to diabetes, like frequent urination, numbness in feet, poor vision, etc. So can you tell from the symptom and how you feel to determine whether you have diabetes or not? Unfortunately, not. Do you know what is the most common symptom of diabetes and prediabetes? It is no symptom. As a matter of fact, when we see the manifestation of these symptoms in the patient, very often the diabetes may have already got really bad. And you don't want to wait till then to find out you have diabetes. So if you have not had your annual checkup yet because of COVID last year, you should go get one. And if your diabetes risk screening is 5 points or more, I highly recommend you to get your blood sugar tested. So there are 3 common tests for diagnosis for diabetes blood tests. The first one is the A1C test. The second one is a fasting blood sugar test. And the third one is the GTT, which is glucose tolerance test. Now, the GTT nowadays is mainly used in pregnant women. Doctors seldom order this test because it's pretty cumbersome. It involves having you drink a big glass of syrup drink, then you wait in the lab and you'll be tested 1 hour after and 2 hours after. Now, for those of us moms, we probably remember this well, don't we? For me, this is the second most awful or painful experience other than giving birth itself during my pregnancy. So not fun. So nowadays, most of the doctor will just order the fasting test or the A1C test. So what is the fasting test? It is the most common test that's been used to test blood sugar. It tests your blood sugar after 10 hours of fasting, and usually you do it in the morning. And so with fasting blood sugar, okay, you get tested. So the normal fasting blood sugar is 99 and below. And between 100 to 125, that is the pre-diabetic range. And if the test is over 126, that is in the diabetic range. Now, fasting blood sugar test, you can do it at home if you have a meter. Just get it in the morning and poke yourself and check your blood sugar. And after, 8 to 10 hours of fasting, you will get the fasting blood sugar number 2. So fasting blood sugar test is like a snapshot, a selfie. This is how my blood sugar looked like at 10:34 this morning. All right. Now, A1C test, on the other hand, is the test for the average blood sugar level over the past 3 months. So we see if if your test result is 5.6 and below, you are in the normal range. Between 5.7 to 6.4, there is a pre-diabetic range, and over 6.5, that is the diabetes range. In general practice, it takes 2 tests to confirm a person have diabetes, either 2 fasting blood sugar tests or 2 A1C, or 1 fasting and 1 A1C test. If all 2 tests are in the diabetic range, then it is confirmed. Now, I want to call your special attention about the blood test. Many doctors only do the fasting blood sugar test, especially you're not overweight. The fact is that even if your fasting blood sugar test is normal, but there may be other time your blood sugar may be high, for example, after a meal. So if you never have your blood sugar tested and you're over the age of 40, please request one. If your doctor is reluctant to give you the test, tell the doctor that you just found out that your distant cousin had been diagnosed with diabetes recently. Okay, say something about, being Asian, we bound to have someone in our blood, among our blood relatives have diabetes. Okay, so I think we all should get a test of not only the fasting blood sugar test, but also the A1C, especially if you have not done it before. Now, I want to talk about prediabetes because a lot of us have it. And remember, 1 in 2 adults in California have prediabetes. All right. So prediabetes' definition is when your blood sugar is higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. And 8 out of 10 people with prediabetes don't even know they have it. Without intervention, 15 to 30% of people with prediabetes would develop type 2 diabetes within the next 5 years. And these abnormal high sugar in people with prediabetes may cause damage in the blood vessels, put them at risk of diabetes-related complications such as blindness, kidney failure, heart disease, stroke, and nerve damage. In my practice, I have quite a few patients who have chronic kidney disease, and their blood sugar level is in the pre-diabetic range. So it could cause damage in the organs. Usually these patients also have high pressure as well. So yeah, just check it out. And so it is the best time to. This is the best time to prevent diabetes. Knowing that if you have prediabetes, this is the best time to prevent diabetes. Why do I say that? Here's the proof. Okay, here's the evidence. So let me introduce you to the NIH Diabetes Prevention Program. NIH stands for National Institute of Health. It's a part of the US government. This is a research-based program involved over 1,000 participants who were all prediabetes. According to their 3-year study, eating a healthy diet, losing 10 to 15 pounds, about 5 to 7% of their body weight, and increasing physical activities to 150 minutes a week. It's shown to reduce the risk of diabetes by 58% among the participants who were under 60 years old. And those who were 60 or over, the risk was reduced by the amazing 71%. Pretty cool, huh? So the study was repeated in Finland and China and other places with similar outcome. So based on the DPP studies and the latest evidence-based research, here are 5 lifestyle change recommendations which can help to lower the risk of diabetes. Okay, being physically active, eating a healthy diet, maintaining a healthy weight, stress management, having 7 to 8 hours of quality sleep. So let's highlight some of them. Okay. Let's see, healthy eating. All right, the CDC, the Center Disease Control, recommend 150 minutes moderate exercise per week. And that translates to about 30 minutes, 5 days a week, or 20 minutes daily. And you can do walking and biking or and running, jogging, okay. Or 6,000 to 10,000 steps per day. Can talk, not sing. What does it mean? Okay. This is a simple way measure relatively intensity when you exercise. So in general, if you're doing moderate intensity activities, you can still talk to your partner, but you're not able to carry a tune. So that way, you know that you are your exercise intensity is in the right level. At strength training 2 days a week, it is great if you can also, on top of what you're doing, the aerobic exercise, like the biking, the walking, that you add the strength training to your aerobic exercise regimen. Strength training helps you to maintain and build muscle mass, which is important for maintaining balance, preventing osteoporosis and loss of muscle mass, and improving blood sugar. So make time to exercise consistently and start slow. If you haven't exercised for a while, don't go out and run for 5 miles. Take it slowly. Add time and intensity gradually. You may also need to get clearance from your doctor if you want to start an exercise regimen and you have heart disease, diabetes, or other health issues. Also, look for opportunity to be active. Park your car further away from the store. Use the stair instead of the elevator. When you brush your teeth, squat, not stand. Okay, you got a lot of training in the in your thigh muscle. So get up after every 10 minutes of sitting. Many of us work at our desk with computer all day long. Do you know that there's a new saying? It says, sitting is the new smoking. It is not for us human beings to sit for a long period of time. After all, we're made to be active, running around and doing stuff. We're called human being, not human sitting. So get up every 30 minutes after sitting. Do some stretching, go to the bathroom, but don't hang out in the kitchen. All right, stay motivated. Well, let me also give you a tip that can lower your blood sugar for sure. All right, so walk right after you have a meal. It helps to lower your after meal blood sugar right away. I guarantee it. So try that. So healthy eating. All right, let's talk about healthy eating. So first of all, we would need to have regular eating pattern, having a consistent time to eat your 3 meals. Now, if you're hungry, add some snack in between. Try to eat about the same amount for breakfast, lunch, and dinner, especially the carbohydrates. Don't just eat one big meal and then snack the rest of the day. Okay, this is not good for your health. Now, as a dietitian, in my experience, one of the most effective ways to help people to eat healthy, lose weight, and control blood sugar is this plate method. As I pointed here on the picture on the right-hand side, this is what the plate method look like. You use a 9-inch plate, filled up half the plate with vegetables. You can see these are non-starchy vegetables like broccoli, mushroom, bell pepper, tomatoes, eggplants. Fill that up, half the plate. And then the other half is divided into two parts. So 1/4 of your plate would be protein, and the other 1/4 will be your carb, your starch. And we recommend whole grain for the starch part. You see, following this plate method is easy to have a balanced meal and portion control as well. Now for the Chinese diet, we don't use plate, and you can adapt this method and turn it into a 2-1-1 type of thing. For example, you can have 2 cups of vegetables, and 1 cup of brown rice, and then 1 cup of meat, which is about, you put into about 3 ounces of meat here. And you can do that a balanced diet and portion control. You don't need to totally avoid carbs. You can just limit the portion size of the carbs and maintain good blood sugar. The key is choosing good carbs. They are the whole grains and processed starchy vegetables like sweet potato, corn, and peas. And lotus is, starchy vegetable. And some of the taro, okay, also they are starchy vegetables. And also beans. Beans is also a carb. These foods are high in fiber and rich in nutrient and antioxidant. You want to avoid processed food and concentrated sweets. Now, it is not hard to identify what sweets are, but what is processed foods? Now, a lot of time people choose brown rice over white rice because white rice is more processed. You're right. You're absolutely right. But what about ramen, rice noodle, like mi fen and chow fen, or crackers and mantou? Do you know that they are processed food too? I see a lot of people, they would not eat the rice. Okay, they stay away from rice, but they would eat crackers and noodles instead, thinking that it is better for them. Wrong. So yeah, just, I think the key is try to eat whole food, try to choose whole grains. That's the bottom line. You also want to choose good fat, olive oil, nuts, avocado in moderations. Avoid trans fat, and they're usually in baked goods, or saturated fat, bacon, butter, coconut oil, palm oil. Now, I want to say that a lot of the Asian snacks that I saw in the supermarket, especially from Taiwan or Hong Kong or other Asian countries, they like to use palm oil, which is very high in saturated fat. Do eat a lot of non-starchy vegetables and choose a variety of colorful ones. They're rich in phytonutrients, high in antioxidant, tons of vitamin, minerals, and fiber. You also want to choose high quality protein like lean meat, eggs, and low-fat dairy. If any one of you interested in seeing dietitians, yeah, it's really beneficial because you can get guidelines how to create a personal meal plan just for you. So it's worth it. So let's look at some real life meal plan here. Okay, with we will look at a modified one, but let's look at a regular meal plan here. This is an actual meal plan for one of my clients. So we see breakfast is 2 boiled eggs, a piece of toast with peanut butter, 1 banana, and a cup of soy milk. Lunch is a bowl of Taiwanese beef noodle, 那个红烧牛肉面, and snack is mooncake. Is we're near the close to the Moon Festival, so mooncakes is everywhere now. So this individual eat half the mooncake for a snack between lunch and dinner. At the dinner, he eat 1.5 bowl of white rice, stir-fried chicken with vegetable, only half a cup of vegetables, fried salt and pepper pork chop 4 ounces, and a cup of ice cream as dessert. Well, you can see that the total calories are almost 3,000. And with the carb, 272 grams of carbs. So let's look at how we could, based on what he eats, and modify the diet here. So we kind of did a little bit of modification here. So in the morning, still have the egg, but now is 1 egg instead of 2. Eat the toast and the peanut butter. Half a banana instead of 1, and 1 cup of almond milk. Almond milk has very little carbs. And so it's a good substitution if you want to stay a little bit low carb. Lunch, a bowl of a Taiwanese beef shan noodle soup, limit to 1 cup of noodle, okay? I'm talking about a measuring cup. It might not be a lot for most people, but they are very high in glycemic index, those noodle that we eat in the Chinese restaurant. So, but he limited that to 1 bowl of 1 cup of noodle with the beef shan, which is lower in fat. Snack, change that to a quarter of a mooncake instead of half a mooncake. Dinner, a bowl of white rice, stir-fried chicken with 2 cups of vegetables, grilled 5-spice pork chop with 3 ounces of it, and a cup of berry for dessert. So the total calorie here is 677 calories and 155 grams of carbs. You see, it cut like 1/3 of the calories and carbohydrates. Now, of course, you can make it even healthier. For breakfast, you can eat oatmeal and some nuts instead of the peanut butter and toast. Lunch, you can have a salad instead of the noodle soup, right? And instead of mooncake for snack, eat a cup of yogurt with some fruits. Dinner, replace the white rice with brown rice, and instead of spare rib, have the steamed fish. So we can make it, healthier. Now, I want to talk a little bit about stress and sleep. Maybe you wonder, how does blood sugar and diabetes associate with sleep and stress? Well, besides food, the hormones in your body play a big role in the rise and fall of your blood sugar. If you stress out and not sleeping well, your stress hormones such as cortisol will go up. It will dry up your blood sugar as well. And so study has shown that chronic stress, sleep disorder, or deprivation can lead to insulin resistance. On the other hand, activities like exercise, meditation, reading, listen to music, or any activity that make you relax, it lower your stress and lower your stress hormones and better for your blood sugar. In clinical observation, better sleep resulted in better fasting blood sugar in the morning. So eating a healthy diet, exercise regularly, rest well, not only improve blood sugar and most likely would help you to lose weight, improve your blood pressure, cholesterol, and make you feel better as well. For those of you who already have diabetes, there is a lot you can still do to stay healthy. First of all, follow all the recommendations for diabetes prevention we just talked about. You also want to make sure that your blood sugar is in good shape. Use your blood sugar monitor to monitor your blood sugar regularly. Do the fasting and the 2-hour after meals. You need the data to manage your blood sugar, okay? It works like a GPS. It gives you the insight into your blood sugar pattern, and then you can troubleshoot the problem. So for example, if you want to find out what food raises your blood sugar, okay, and what food is good for you and how much you should eat, check your blood sugar before your meal. Then wait for 1.5 hours to 2 hours, check your blood sugar again and compare the 2 numbers. Then you will know what food is good for you and what food make your blood sugar go up. So normally you want to, if the difference is more than 40 or 50, that would probably raise your blood sugar too much. So try to aim at before and after meal, the difference about 50 or under. So regular visits with your family doctor or endocrinologist. Ask your doctor to refer you to see a diabetes educator to help you to manage your diabetes if you have not seen one. It is Your doctor only have, 20, 30 minutes for you, but we take an hour to get to know you and help you to manage your blood sugar, modify your diet and lifestyle so that you would able to achieve your goal. And the diabetes education are covered by Medicare and most insurance, all right? And so it's worth to get a referral from your doctor to see a dietitian or diabetes educator. Know and control your diabetes A1C. What is the diabetes A1C? So A stands for ABC. So A stands for the A1C. Okay, the 3-month average blood sugar. You want to keep it under 7. B is the blood pressure. C is for cholesterol. Have these tests done regularly. And make sure that you take the medication as directed by your doctor. Don't play doctor yourself. I see a lot of people get in trouble this way. Take care of your feet and examine them regularly. Get regular dental and eye checkup. Let me conclude the presentation with this cartoon. And let's be diligent to stay in good health. Thank you very much.